Hello, friends. There is a Medicare deadline hitting in June of 2026, and if you are 65 or older and you or your spouse recently stopped working, it could cost you more than $5,000. That is not a guess. The 2026 Part B standard premium is $202.90 per month. Miss your enrollment window by just 2 years, and the official penalty math comes to $5,843.52 over 12 years. And that penalty is permanent. It does not go away. But that is only one of 5 Medicare timing mistakes seniors are making right now around mid-year. And the reason most people get caught is not because the rules are hidden. It is because nobody puts them in one place and tells you your personal clock is running. Hello, friends. This is not one deadline. That is the first thing I need you to understand. What you are dealing with is a cluster of personal Medicare clocks, 5 of them, and they are spread across different agencies, different mailings, and different months. No single office tracks all 5 for you, so grab a pen right now and mark the ones that apply to you, because at least one of these is yours. And I am willing to bet the one that costs you the most is not the one you think it is. Now, if this is the first time you have found this channel, here is what we do. Medicare rules shift every year. Premiums change, income limits change, enrollment windows move. But the bigger problem is not the changes. It is that the rules live in different offices and different letters, and nobody puts them together in one place for you. The people subscribed here find out in time. Subscribe now and let's get into it. Before we go further, I need to address something, because people hear a video like this and immediately sort themselves into one of 2 groups. The first group is comfortable, some savings, a decent retirement, and they figure this is for people in worse shape. The second group is on a fixed income, counting every dollar, and they have learned to assume the good programs are always for someone else. Both of those assumptions are wrong about at least one of the items I am covering today. And on every single one, I will tell you exactly which group it helps most. The comfortable group is going to be surprised by number 3. The fixed income group is going to be surprised by number 4. And stay until the end, because the last one is not a date on a government calendar. It is a letter in your mailbox. And if you ignore it for 30 days, the help can stop. That one is worth about $5,700 a year. Number 1. The June Part B Special Enrollment Period cliff. Most people who work past 65 hear the same thing. As long as you have coverage through your job, you can delay Part B and sign up later with no penalty. That part is true. But here is the misconception that is costing people real money. They think COBRA counts. They think retiree coverage counts. Neither one does. Medicare's Special Enrollment Period, that is, the protected window to sign up for Part B without a penalty, runs for 8 months after your job or your employer group health coverage ends, whichever happens first. Not 8 months after COBRA runs out. COBRA is not considered group health plan coverage for this purpose, and it does not extend the window. The Centers for Medicare and Medicaid Services are explicit about that. So here is the scenario that is real right now in June of 2026. If your employer coverage ended in October of 2025, your 8-month clock is running out this month. And if you do not file before that window closes, you fall into the Part B late enrollment penalty. Here is how the penalty works. For every full 12-month period you could have had Part B but did not, Medicare adds 10% to your standard premium. The 2026 standard Part B premium is $202.90 per month. Miss it by 2 years, and that is a 20% penalty, $40.58 extra per month on top of your premium. That is $40.58 every single month. Over 12 years, using today's Part B premium, that is $5,843.52 gone for nothing but a missed clock. And that penalty does not expire. It stays on your premium for as long as you have Part B. Who does this hurt most? Both groups. If you are on a fixed income, a permanent premium increase on a bill you will pay for the rest of your life is devastating. If you are comfortable, you get caught because you assumed COBRA or retiree coverage was still protecting you. It was not. A viewer wrote in about this exact confusion. A retired payroll clerk named Linda, 67, outside Dayton, Ohio. She delayed Part B while covered through her husband's current job. His employer coverage ended in October 2025, and they thought COBRA meant they were safe through the rest of 2026. They were wrong. If she lets that mistake drag into a full 24-month late enrollment gap, the official 2026 math becomes a 20% penalty, $40.58 extra each month, or $486.96 a year, permanently. Here is the action step. You need to submit 2 forms to Social Security, CMS-40B, which is the application for enrollment in Part B, and CMS-L564, which is the request for employment information. Call Social Security at 1-800-772-1213 TTY, 1-800-325-0778, and use the exact words, "I need to enroll in Medicare Part B using my special enrollment period for job-based coverage, and I want to submit CMS 40B and CMS L564 now." Your deadline is 8 months after the job or employer coverage ends, whichever happens first. That is number 1. And that one can raise your premium for years. The next one does not raise a penalty. It traps you in the wrong plan. Number 2. The Medicare Advantage switch window that already closed. If you are in a Medicare Advantage plan right now and you are not happy with it, the network changed, the costs went up, your doctor left the plan, you may be assuming you can fix that whenever you want. You cannot. Medicare Advantage has its own correction window called the Medicare Advantage Open Enrollment Period. It runs from January 1st through March 31st. During that window, you can make one change, switch to a different Medicare Advantage plan, or drop back to original Medicare and pick up a standalone Part D drug plan. That change takes effect the first day of the month after the plan gets your request. That window closed on March 31st. If you missed it and you do not have a special enrollment period, which requires a qualifying event like moving out of your plan's service area or losing other coverage, your next chance is the annual Medicare Open Enrollment that runs October 15th through December 7th, with changes taking effect January 1st. That means you could be stuck in the wrong plan for 9 months. 9 months of the wrong network, the wrong formulary, the wrong costs. Who does this hit hardest? The comfortable group. This is the person who is used to shopping for plans the way you shop for car insurance. You compare, you switch, you move on. Medicare does not work that way. The windows are fixed, and once they close, they close. Here is your action step. Call your plan or call 1-800-MEDICARE. That is 1-800-633-4227. TTY 1-877-48-62048. And ask this. I am already in Medicare Advantage. Do I have any special enrollment period right now, or do I need to wait until open enrollment? If the answer is wait, start your plan comparison now so you are ready the day October 15th arrives. That is number 2. And being stuck in the wrong plan is bad enough. The next window is worse because it does not just affect this year. It changes whether a private insurer has to take you at all. Number 3. The one-time Medigap window that starts when Part B starts. Now, everything I have covered so far has been about money leaking out month by month. A penalty here, a bad plan there. This one changes the menu itself. I need you to hear this one carefully. When you turn 65 and enroll in Part B, a federal clock starts. You get a 6-month Medigap open enrollment period. That is the window when private insurance companies that sell Medigap policies also called Medicare supplement plans, generally have to sell you a policy without medical underwriting. They cannot refuse to sell you one. They cannot use your health history against you. They cannot charge you more because of a pre-existing condition. That window is 6 months long. It starts the first month you have Part B and are 65 or older. And here's the part nobody tells you. It does not come back. This is not an annual enrollment. It is one time. Miss it, and after that window closes, a Medigap insurer can deny you, charge you more, or refuse to cover conditions you already have. This is not a bill you can cancel next month. It is a door that opens once. Who does this surprise? The comfortable group. This is the homeowner with some savings who wants predictable medical bills and figures Medigap will be there whenever they get around to it. It may not be. And if you have a health condition that developed after you turned 65, the difference between applying inside that window and outside it can be the difference between getting covered and being turned away. Here is your action step. If your Part B started within the last 6 months, check your Medigap eligibility immediately. Contact your state insurance department or your local SHIP counseling program, that stands for State Health Insurance Assistance Program, and say this: my Part B started on, give them the month. I want to know whether I am still inside my Medigap open enrollment period. Do not wait. Federal Medigap rights are different for people under 65 on Medicare due to disability, and some states offer more protections, so ask about your specific situation. That is number 3. Now let me flip this around because not every June mistake costs you money. One of them is about money you are still paying that the state may pay for you. Number 4. Medicare Savings Programs. The money still sitting on the table. Here's the misconception I hear more than almost any other. I own my home. I have a little savings. There is no way I qualify for help. That assumption is wrong for more people than you think. And the research backs it up. A study published in JAMA Network Open found that about 56.7% of Medicare beneficiaries eligible for Medicare Savings Programs were actually enrolled. That means roughly 43.3% of eligible people were not getting the help they qualified for. So let me tell you what these programs are. Medicare Savings Programs. There are 3 main ones called QMB, SLMB, and QI, are run by your state Medicaid agency. In plain English, they can pay some or all of your Medicare costs, depending on your income and resources. QMB, that stands for Qualified Medicare Beneficiary, is the broadest. It pays your Part B premium, your deductibles, your coinsurance, and your copayments for Medicare-covered services. In 2026, the income limit for QMB is $1,350 per month for an individual or $1,824 per month for a married couple. Resource limits are $9,950 individual, $14,910 married. SLMB, Specified Low-Income Medicare Beneficiary, covers your Part B premium. The 2026 income limit is $1,616 per month individual, $2,184 married. Same resource limits. QI, Qualifying Individual, also covers your Part B premium. The 2026 income limit is $1,816 per month individual, $2,455 married. Same resource limits. But QI has a catch. You must apply every year, and states approve applications first come, first served, with priority going to people who had QI the year before. And here is the bonus most people do not know. If you qualify for QMB, SLMB, or QI, you also automatically get extra help with your Part D prescription drug costs. Who does this help most? The fixed income group, clearly. But here's the surprise for the borderline households. Some homeowners with modest pensions or Social Security-only income still fit under QI or SLMB. States can be more generous than the federal floor, and some states do not count resources the same way. You may still qualify even if you look slightly over. Consider a retiree named Robert, 72, in Mesa, Arizona, a retired machinist. He was paying the full Part B premium out of his Social Security check every month, and assuming any state help was for people poorer than he was. He was wrong. If Robert qualifies for a program that pays his Part B premium, that is $202.90 more in his pocket each month. That is $2,434.80 a year, before you count a single deductible or copay. Here is the action step. Contact your state Medicaid office and say, I want to apply for a Medicare Savings Program, and I want to know whether I qualify for QMB, SLMB, or QI. There is no federal filing deadline for MSPs, but QI requires yearly reapplication, and it is first come, first served. Applying early in the year, before summer, is a strategy, not a legal deadline, but it is a smart one. You can also call 1-800-MEDICARE at 1-800-633-4227. And this is not automatic. Your state Medicaid office does not assume you want this and file it for you. The money sits there until you ask. That is number 4. That is help people miss on the front end. The last one is help people lose on the back end just because they do not answer a letter. Number 5. The extra help letter you cannot ignore. This is the one I told you to stay for. It does not look like a deadline. It looks like mail. Medicare Part D Extra Help, also called the Low-Income Subsidy, helps pay your drug plan premiums, deductibles, and copays. Social Security estimates it is worth about $5,700 a year. And here is the good news. You can apply for extra help anytime. There is no enrollment window to miss. While you are getting extra help, you also do not pay a Part D late enrollment penalty. So what is the trap? The trap is the yearly review. If you already get extra help, Social Security reviews your eligibility. They send a review notice in early September. That form has a 30-day return clock. If you do not return it within 30 days, your extra help may end. Then in September, you may also get what is called a loss of deemed status notice. And in November, you get the final decision notice. Here is the problem. That September letter does not arrive with a siren. It does not say this is worth $5,700 on the envelope. It looks like every other piece of government mail. And people set it aside, or it gets buried, or it goes to an old address. 30 days pass. The subsidy stops. Social Security says this help is worth about $5,700 a year. Lose it over a piece of mail, and that is real money leaving your house. Over 3 years, that is roughly $17,100. Who does this hurt? Both groups. If you are on a fixed income, losing drug cost help is an immediate crisis. If you are comfortable but auto-qualified through Medicaid, a Medicare Savings Program, or SSI, you can still lose it by ignoring the wrong notice. The review does not care how you qualified. It cares whether you responded. Some people qualify automatically through Medicaid, MSP enrollment, or SSI. Others must apply directly. If you are not sure which path you are on, that is exactly what you should find out now, before September. Here is the action step. If you already get extra help, watch for that review notice in early September and return it immediately. If you think you may qualify but have never applied, file Form SSA 1020 through Social Security. Call 1-800-772-1213, TTY 1-800-325-0778, and say, I got a Social Security review notice about extra help, and I need help returning the form before my subsidy ends. Or, If you are applying for the first time, I want to apply for extra help with my Medicare prescription drug costs. Verivry, exact 2026 national income and resource thresholds for extra help should be confirmed on production day, as current Medicare and SSA consumer materials are not fully aligned on the public-facing figures. That is number 5. So here is the full picture. 5 clocks, 5 different agencies, 5 different pieces of mail or missing mail. The Part B Special Enrollment Period that can turn into a permanent penalty if you mistake COBRA for real employer coverage. File CMS-40B and CMS-L564 through Social Security before your 8-month window ends. The Medicare Advantage switch period that ended March 31st. If you missed it, check for a special enrollment period now or prepare for October 15th. The one-time Medigap open enrollment that starts when Part B starts and lasts 6 months. Check your start date today. The Medicare Savings Programs that may pay your entire Part B premium, one application through your state Medicaid office. And the extra help review letter that arrives in September with a 30-day clock. Do not set it aside. Now here is the part that ties all 5 together. Social Security does not call when your 8-month Part B clock is about to end. Your Medicare Advantage plan does not remind you in June that the switch window closed in March. A Medigap insurer does not chase you down to tell you your federal protections are expiring. Your state Medicaid office does not assume you want QMB, SLMB, or QI and file it for you. And a review letter in September does not look dramatic enough to warn you what it is worth. Being legally entitled to relief and actually receiving it are 2 different things. The gap between them is information, and that is exactly why this channel exists. So here is what I am going to ask you to do. Think of one person: a spouse who retired last fall, a neighbor who just started Part B, a friend in Medicare Advantage who keeps saying they will fix it later. Send them this video. Not because they are careless, because these clocks are split across agencies and mailings, and nobody puts them in one place. You just watch someone do that. Now pass it along. Subscribe. Share this with someone you know who is on Medicare or about to be, and I will see you in the next one.